So I worked under the Food Insecurity and Population Health Fellowship. And just a little bit of context. So I'm currently in my 6th term at Bennington. I'm a junior, and my plan is primarily in public health, focused on preventative care, and then of course in drama, because it's just a personal passion of mine. And the role I worked under was as opioid response and social determinants of health advisor at the Southwestern Vermont Medical Center. The main 2 mentors that I had were Alex Figueroa, and he's the Community Action Grant Project Supervisor and the Blueprint Care Coordinator, as well as Kristi Cross, and she's the project director of the opioid response team and the director of Bennington Blueprint. So Blueprint for Health is basically they design community initiatives that are focused on health and well-being through the hospital. And then the opioid response team, they've received the community action grant money to go ahead and install other programs for people's well-being. And the main mission is essentially to support individuals who are struggling with substance and opioid use disorders in Bennington County. So some of the responsibilities and what I learned from them. So I started by going to a lot of different meetings, a lot of different stakeholders, because this works on a varying amount of levels. And that kind of introduced me to the important aspects and what was more relevant in this work. And one big thing I noticed was the understanding of the importance of language and how you address certain people who are suffering from opioid use disorders or substance use disorders, because often these people are treated in a dehumanizing manner. So that was something that I really took into account. And another thing is the social determinants of health. And so being in a rural area here, a lot of the individuals who are struggling, that has to do with the socioeconomic background they come from, because that influences one's overall well-being. And so from these responsibilities, I kind of decided to piece up and come up with my own project, which I'll be moving on to now. And that was the Bennington County Resource Directory. And my idea, because so many resources already existed, for example, harm reduction bags, or with Turning Point, they had all of these different therapists to help that were known as recovery coaches. I realized that there were a lot of resources, but there was no accessibility to them in one place, especially in the time of COVID. I figured that that was something that was really important to provide. So I decided to make an accessible web platform that would support and amplify a website down the road that would also go on the Southern Vermont Medical Center platform for their opioid response team. And this kind of elevates the importance of hope as well for people, because you kind of just see it, it clicks on a link. It also provides you things like the Wi-Fi maps and the different food pantries. And so I guess I wanted to utilize what I learned to create something that further benefits that mission of my fieldwork term. And so overcoming some challenges, I had never made a website before, so that was an accomplishment, but also just learning a lot about this area, not being from here myself, was very interesting to kind of come in with that lens. So just to show you guys a little bit, this is the homepage of the Bennington County Resource Directory. It is divided into 4 subsections so that everyone can kind of easily click on a link and go from there. And just to show you guys more of it, this is what the pages look like. And you basically just click on the links and it redirects you to the exact page. Each page also has hotlines and different housing resources, as well as transportation, because it's hard to get places and to find ways to go there. And so it kind of encapsulates all of the different resources found on the state level and the community level, more smaller initiatives. And yeah, as you can see, more hotlines. And so kind of getting to the future point, I will continue to attend the subcommittees of the Bennington Opioid Response Team, which is like different little groups that focus on, for example, youth or law enforcement. And another thing that I really realized is that I definitely want to further explore this field in terms of preventative care, specifically catered on substance use disorders and opioid use disorders, because I think when it comes to youth, there's a lot you can implement and a lot of programming you can provide to kind of prevent that from developing. And so that definitely did have an effect on my Bennington plan and professional aspirations. And last but not least, of course, I just want to say a big thank you to all the donors and all the people who helped me, my project mentors. It was truly a great experience, and I couldn't be more happy with the outcome. So thank you for having me.